are managed. Oh, thank you. They are managed by Whitney Reynolds, their program director, and Natalie Cleveland, the member coordinator. Um, both previous HHCK employees, so it's a small world. And I'm excited to see what they have going on. If y'all have any questions, feel free to drop them in the chat. And yeah, I'll get back to you.
Thanks, Valerie. Good to see you all today. Very warm Friday afternoon. We will definitely want to keep this informal. So if anybody at any time has any questions, please just stop us. I will try to see if there's stuff going on in the chat, but you can definitely unmute yourself. Like Valerie said, Natalie and I are both HHCK alumni. So we thank you all for your service as AmeriCorps members with Homes for All. And we are here today to share a little bit of information about the Kentucky Public Health AmeriCorps program, who we are, what we do, what our members are doing. We have a similar kind of setup that Homes for All does, and that we are a statewide program. So hopefully you'll see some similarities as we go through what we're doing. So, what does local public health do? Maybe you are somebody who has utilized the public health department before, and if you've ever wondered what they do beyond the services that you have utilized, I think this is a good chart to look at kind of quickly. And I will focus in on the core public health services there in the middle. These are the programs that our AmeriCorps program is serving within. So these are programs that are available in all Kentucky counties, the WIC, HANDS, and harm reduction programs. But then if you look out at the other two columns, the foundational public health services and the local public health priorities are also what your local health department is responsible for and working towards as well. So the mandatory for Kentucky health departments, the population health, the enforcement of regulations, emergency preparedness and response, communicable disease control, and then administrative and organization management. You've seen probably some alerts about outbreaks that we've had recently, unfortunately. So that's going to fall under your health department. And then if you utilize the health department for WIC, HANDS, or harm reduction, that's what our members are serving within. So most of our members are serving within harm reduction and some WIC. We just have a couple members that are serving within the HANDS program, but we're hoping to increase capacity in each of these programs. Oh, I've lost my. Uh-oh. Sorry. Okay, so who can host a Kentucky Public Health AmeriCorps member? So every local health department in Kentucky is eligible to host a member. And this is a map, I think, that's helpful to see how health departments are arranged in the state, in the Commonwealth. So some health departments are single county health departments and some are regional health departments. So the colors that you're seeing are showing the regional health departments, and then just the counties that are not colored, that are just white, those are single county health departments. So for our members that are serving in a regional system, they're still serving just in one county, but it helps to see, I think, to know the breakup of how health departments across the Commonwealth are split up. So we've got some members that serve in the Kentucky River District over there in Eastern Kentucky, the county's in red. And it's kind of an odd breakup because for some reason Breathitt County is just left out there on their own. So we've got a county, and that's an independent county surrounded by a district health department. So in this last program year, or sorry, this most current program year, we've had 27 members that were enrolled. Always hoping to increase that number as we move forward. So what type of service are our members providing? We already touched on this. Hands harm reduction, and WIC, and then that's going to encompass some health education and outreach. But what does that really look like? So I know that this is a little bit wordy. I'm happy to share this afterwards, but we've kind of broken out some of the activities that our members are doing or have done or will do within each of these programs. So our members that are participating in WIC are going out to grocery stores and high traffic areas like libraries or clinics. They're collaborating with both sides of the program, so healthcare providers, schools, community centers, and then participants of the WIC program themselves to increase the enrollment to get those numbers up to increase participation overall. The HANDS program, connecting again on both sides of the coin there, connecting with local healthcare providers, community organizations, and then trying to increase participation in the program itself. So harm reduction is, as I mentioned before, our program that has the most members participating. So this encompasses quite a bit, offering support one-on-one to folks that are utilizing harm reduction services. So folks that are experiencing substance use disorder, helping them navigate available resources. And this is where we might have members reach out to you at the organization that you are serving with, because this is going to include access to food, access to housing, access to whatever folks are looking for that can help them on their path, whatever resources they might need that will help them as they are navigating their harm reduction, whatever they need. So we also have members that are trained or are training to do syringe exchange. So folks can come into a health department that has syringe exchange and exchange a used needle for a clean needle. We have health departments that have naloxone, so they can pick up naloxone to use safely wherever they are, and that helps to reverse opioid overdoses. Not every health department has that available, but a lot of them do. And there are health departments around the state that have like naloxone boxes around the county, so that they can get that out to a larger percentage of the population. And then health, just the education and outreach, it's a little bit new, but some members are going to be going out into the community to promote other aspects of the health department, other programs that health departments are promoting. Oh, I'm going to pause this just for a second. I'm going to try to turn my volume up. Hopefully you'll be able to hear Priscilla talk about just what she does on a day-to-day basis at her site, which is the Mercer County Health Department.
Hello, my name is Priscilla Miller, and I'm a Kentucky Public Health AmeriCorps member at the Mercer County Health Department. And in a typical week, I could be out in the community serving the public at DCBS, Social Security, Housing Authority, or in the schools teaching Too Good for Drugs. I do what I do to make our community a better place to live, and it actually has helped me heal from the inside and taught me to be a better person also. So it's a win-win all the way around to be an AmeriCorps member.
Okay, hopefully you were able to hear Priscilla. She is in her last year in AmeriCorps service with the Mercer County Health Department. So who are some of our members? We do have college students that are majoring in the public health field. And we do have members that are satisfying some internship hours that they have to complete within their major. We have people with lived experience, either themselves or a family member. And then I think that I would confidently say that all of our members are public health fanatics. And maybe not everybody, but I think that our members are passionate about providing public health services to their communities, whatever that may look like. And our members here, this is up in the corner, is a member in Lee County at the Kentucky River District. And in the center, there is Malaysia that is serving in Graves County in Western Kentucky. So what does our training look like? Every AmeriCorps program has training that's a little bit different. So our training is, of course, provided by Natalie and I as the AmeriCorps staff, health department staff, and then Serve Kentucky, just like you all receive training at KAA. So we want our members to receive training within the appropriate programs, WIC, HANDS, and harm reduction. We want them to receive the tools and knowledge needed to serve their communities within the public health programs that they are serving in. So something that's a little bit unique to our program is the community health worker training and certification. So every member that is in the Kentucky Public Health AmeriCorps program has the opportunity to become a certified community health worker. We set up the training with Home Place, and the mentorship hours that come after the training are able to be completed while members are in service as an AmeriCorps member. And I'm going to tap Natalie here to talk about what a CHW is, what that entails, because Natalie is a certified CHW.
Hey everybody. So for our program, um, when you get through the process and you become a certified CHW, what it looks like for our members, um, kind of takes on that piece of that health education. They are going into the schools, and being on the front lines to advocate, for vulnerable populations, and also teach, um, students, staff, different things that they may not have access to, just in their communities, and give the same information that they might not, like I said, may not have, like information about harm reduction in that arena. So like appropriate for school age, which is like tobacco use and vape use. Our member Priscilla, she does a lot of that in the schools. Um, and some of the other members are taking on that right now. And then they can help with doctor's appointments for clients. They can help with housing needs for clients. I know we have one member who called Valerie because she called HHCK and she was advocating as a CHW for a client, and she didn't know who to call at HHCK, but she had Valerie's card from KAA, and that's who she called. So it's good. It provides connections, in the community, just to be there on the front lines for folks. CHW has two tracks, and our members do take the training track, but there is another track which is, like hours through, work, like work experience. It is a lot more hours that you have to have for that, but let's say you go through and you're a full-time member and you have like the 1,700 hours, and let's say you come back and serve another term, and then you go and you apply for a CHW job somewhere, or you apply for a job that wants you to have a CHW certification, you can utilize the time that you spent as a member as work served, as long as it meets the 8 core competencies, as CHW needs to become certified. You can utilize that time, to get that certification. So there's lots of things to do with CHWs, and Kentucky is constantly trying to grow that, especially with the Medicaid reimbursements and things happen in our communities. So if anyone has any questions about CHW and you just don't want to wait to ask, send an email to someone at the state or anything like that, please reach out to me and I will answer those questions for you the best of my ability.
I have a quick question. We had Priscilla with Kentucky Voices for Health on a few months ago talking about being a connector. And I know, Natalie, you were a previous connector. So what are the differences between those?
The differences between the two are that a connector can actually sign you up for the benefits, as far as Medicaid, or child care assistance, or food stamps. A community health worker can help you through the process, can help you with your paperwork and things like that, but they can't get into the system to complete your application, versus a connector is into the same system that the DCBS worker utilizes. And as soon as they're done with your application is complete. Whatever they tell you that you need for your application is what you need that DCBS would tell you. That's kind of the difference in what a connector could do as far as those benefits and what a community health worker can do. A community health worker could help you understand the paperwork more, understand what they're asking you to do, where you can get the paperwork from, help you obtain the documentation that DCBS is asking you for to get it turned in. Any other questions?
Thank you, Natalie. All right, I'm going to keep going, but if anybody has questions, definitely type them in the chat, and our contact information's at the end as well. This is, you all know this, AmeriCorps members are definitely different from staff, so I'm gonna kind of skip over this one. So, our program, the one thing I'll say is our program has only had 1,200 and 900 hour positions for the last 3 years, but we will have 1,700 hour full-time positions moving into this next year. I'm gonna pause her and turn my sound up just real quick. And this is Lauren from the Marshall County Health Department in Western Kentucky, and she's in her first year as an AmeriCorps member.
Kentucky Public Health AmeriCorps member. I'm here at the Marshall County Health Department where I work. And usually my typical day is varies for the week and the day, but I usually just do weekend hands outreach, zip pamphlets, getting that out to the community and helping to make sure that they know about the resources there.
So Lauren serves in the Wiccan Hands program, so she does a little bit of both. So she's different in that she's one of our folks who does not do harm reduction and across the Commonwealth. So she spends a lot of her time doing outreach within those programs, reaching out to clients to make sure they're getting the information they need, and then trying to set up locations where she can provide additional outreach in her community of Marshall County. And Lauren is a college student and hopefully will be coming back for a second year next year. So we're getting to the end of our info session. So if you are or somebody you know are interested in becoming an AmeriCorps member in our program, our website, we are housed in the Kentucky Health Department Association. So that website will take you to the Kentucky Health Department Association, and then you'll navigate to the AmeriCorps page. We have an online application and a criminal history check consent form. And once we get those, we contact folks and follow up from there. And then that's our contact information. Dana there is with Natalie and I, and then that's Dr. Stack from the Department of Public Health. And there's, I didn't fill in our phone numbers. I'm really sorry, y'all. We have our phone. Those are not our phone numbers. But we can get those to you. But that's all I've got. So if anybody has questions, please let us know. And I'll stick around for a little bit, but otherwise I'll hop off. Natalie and I'll hop off so that you all can finish your meeting. But I appreciate you all taking the time to listen to us and learn about our program today.
Yeah, thank you all so much. We all really appreciate it. There's definitely a lot of overlap. Um, I say housing supports life support, and I think that's similar with public health support and just trying to do whatever you can to make things better for clients. Um, yes, in the wrap-up email, I'm going to try to collect some resources so you all can reach out to local health departments, get connected with them, see what resources they have that you can share with clients. So yeah, I'm really excited about us getting connected. And if you all have any questions, feel free to, yeah, contact them, ask me for their contacts, or I'm happy to forward it their way. Um, yeah, thank you
I
all.
also think it's a good point, like, as we mentioned, there is such an overlap in what the two programs are doing, but also, with utilizing your local health departments, knowing that there are hopefully, AmeriCorps members close by or maybe in the same communities, and you're making that connection with another fellow AmeriCorps member, and maybe they are doing something that could really benefit a client or a family that you are serving. So it again all around benefits the people that you guys are serving within both programs. And thank you, Whitney. Thank you, Natalie. We appreciate it. And you guys have a great weekend and enjoy the sunshine before it rains.
Totally. Okay. Let's see. What time is it?
2:26.
2:26.
Yeah.
Yes, we have time. I want to do the check-in question. So, yeah, if anybody wants to share, I don't really like popcorn style. It's kind of stressful. Um, but yeah, I want to do show and tell an item that brings you joy or like a person, something that comes to your mind.
Do you care
You
if
can
I
drop in
go?
the chat or chat. Yeah, go ahead.
Okay, great. Well, it's at the office, but I have a little pickle that my sister got me for my birthday last year as just like a little gift. I am a lover of pickles, which is really funny. Anyways, it has a little inspirational card on it, and it says remember that you're a big deal. And so I do like to look at that when I'm having maybe a more difficult day. So yeah, that's just something that I like to look at that makes me happy while I'm working.
It's like a little plush pickle, not an actual pickle. It is cute. Little emotional support pickle.
I can go next if you would like.
Go ahead.
Okay, can you all see me? Because it's not showing me, but it says the video's on.
It's probably because I'm sharing my screen. Hold on.
Oh, hey, that's okay.
There
So
you go.
something that brings me joy is Mr. Herbert, who most of you all have met. But Cindy, when I worked at the Travel Academy like 7 years ago, got me this when I left. And it's a cute little teddy bear with a bow, and he's an AmeriCorps teddy bear. And then when I'm stressed, I take my little rock wolf and I collaborate when I'm on a hard phone call and I have to tell them no. It's easy for me to stress it. Okay, thanks.
Amazing. Beautiful. Love it. Thank you. Anybody else want to go? Noah says he has a necklace made of cogs in the shape of a shield that he's had for 6 years now. given to me by my fiance for our first Christmas. No, it's fine, Noel. Yeah, that's really sweet. See? I'll share another one. Got this little plant. Don't know what it's called. You're okay, Ashley. It's got a little pest problem, so she's in quarantine right now. But she seems to be doing better, so that brings me a little joy. Yeah. Sonia says she keeps small toys on a bookshelf behind her desk to give them to littles who come in with their mom to complete the forms. Oh yeah, I love that. I've seen those plushies, but never thought to ask about them. Um, cool. And you had a shark plushie you could give to a client that likes sharks. I love that. Yeah, Ashley said her boys bring her joy. So yeah, I'm smiling. I'm glad. Yeah, we got to share for a little bit. Oh, little toys, right?
Oh, I said a while ago.
Go ahead.
I know I said a while ago that my son brings me joy, but
Yeah.
I have like a tangible thing that I really like. It's this blanket. It's a Vera Bradley bank blanket. It has my mom's name stitched into it. It was something that I bought her for Christmas one year, and she passed away in 2008, teen. And ever since then, I've just kept this blanket. Like I take it with me everywhere I go. Like because she always took it with her to the hospital because she had cancer, so she was in the hospital a lot. And so that's kind of like my comfort blanket. Like I feel like it's a part of her, so I carry that with me a lot everywhere I go.
Yeah, I love that. Vera Bradley blankets are very cozy. I love that. Thank you all for sharing. I really appreciate it. Okay. Happy AmeriCorps Week, you all. It is AmeriCorps Week. If you haven't already, go check out Homes for All, our social media posts. Um, yeah, we did like highlights of everybody that wanted one and completed the survey. So feel free to share and brag on the amazing service that you're doing. We love to brag on you all. So yeah, the agenda for today, going to share a few announcements, development opportunities. We're going to talk about the Spring Service Project, and then I'll wrap up. So not too long. Holly's birthday is coming up on March 18th. And then Jackie Charles, she's not on the call today because their site's closed on Fridays, but Jackie's birthday will be coming up on the 27th. She's a partnership. Non-Vista member, so our direct service members, performance measures for February are due today, unless if you let me know when you'll be turning those in, that's fine. And then, yeah, keep an eye on your email. I'll be scheduling just informal check-ins just to see how you're doing, what you've got going on, and everything. These development opportunities, I'll talk about the poster on the right. There's going to be an upcoming webinar March 21st at 11 a.m. ISM Eastern Time on mental health and housing. And this is presented by the Kentucky Fair Housing Council. And that we have Noel serving there. And so they'll be talking about how those things intersect. I'm excited for it. I think that'll be a good one. Dr. Megan Marks. So I believe I should have shared it in the March email, but I'll include this poster in the wrap-up email for this as well. Yeah, if you see anything, free webinars, resources, valuable resources that could be shared with other members across the state, I always appreciate those. You are the ones with the nearest proximity to those types of things. So yeah. And this is our recently released data, I think for 2024. So across Kentucky, it's kind of wild. We have 700 local service sites. I'm going to take a peek at the chat. Yeah, you're fine, Noel. No worries. Okay. We have over 5,000 members, $33 million in AmeriCorps and local funding, and $66 million of AmeriCorps scholarships earned since 1994. So I'm very proud of the state and the service that we're doing for like the little service projects that could. And so, yeah, I love you all in the service that you do. And I really appreciate it. You're a part of this bigger thing. And I also, Holly added these Homes for All 23-24 highlights. So not this program year, we're in 24-25, but the previous one, Homes for All had recruited, and I know it's even over these numbers, over 177 volunteers that served over 1,000 hours. We served 40 people affected by disaster, 615 children, almost 2,000 individuals, which I believe was our goal or target. And the number of individuals that transitioned into safe, healthy, affordable housing was 425, which was half of our target. So this is why the performance measures are so much, because we get to compile it and really show with this data the really good work that we're doing. So yeah, our returning members, like this is all you. So thank you all, and I'm really excited to collect what we have this year. But this is how we use that data and how we talk about it. Okay, this is an exciting one. We are now planning our spring service project. Sorry, I just put the dates. This is going to be in May. May 21st through 23rd in Paducah. I know that's a stretch. That's why we're talking about it now. And I'm going to send out the RSVP form so we can start planning if possible. So yeah, this a rough agenda. It looks like we will be traveling to Paducah on the 21st. That'll be a travel day for everybody to get down there. And we will be staying in hotels, rooming together as much as possible. On the 22nd, that's going to be a full service day. I'm not entirely sure everything that our project is going to consist of. Currently, we know it may involve painting, but things could change. And then the 23rd, we'll do some work in the morning, wrap up by lunch, and then we'll head home. Members will be required to carpool if other members are in their service area. If you don't carpool when possible, we will not be able to reimburse it. Food and lodging will be provided. And yeah, more details in the RSVP we'll share soon. So I'm really excited. Last year we were at the Housing Opportunities of Northern Kentucky and we mucked a pretty gnarly house. Very proud of that one. We got it done, cleaned it out, and I don't think it's like ready yet, but it should be soon. So that's really cool that we were like some of the first people to step in there. Oh no, no worries. But yeah, this is in May 21st through the 23rd.
I will say, just to kind of add to give you an idea, the project with Paducah Alliance of Neighbors, it will be like a repair project. Val, I don't know if you said that, but I do believe like the family will be there. There will be a family. It's not going to be like a vacant home or a new home build. So we are going to be interacting with the family on the house or houses that we're going to be working on.
Cool. Yeah, no, I didn't know that. Thank you. Okay. Yeah, to wrap things up, by the time of our next program meeting, I think tax season will be over, but I just want to say it again, if you haven't filed yet, you don't have to pay for your tax prep if you make under 60K or so. You can get free help with VITA if you just Google. That's since for volunteer tax assistance. So they're volunteers that will help you complete them for free. You do have to pay taxes on your living allowance or file your taxes, and so those are sent out. Yeah, I'll send the Spring Service Project RSVP. Really excited. Check out the March email that I sent yesterday. It includes optional opportunities to get ahead on, excuse me, service hours. Also some interesting news articles of what's going on. I know it's kind of right now a barrage of information at the national level. But that's some more local stuff and some exciting wins that we have. Our next monthly member meeting is going to be on April 15th at 2 p.m. We're going to have one of our very own members, Noel Wallace with the Kentucky Fair Housing Coalition, and he's going to give us their fair housing rundown, 45 minutes to an hour or so. Fair housing is one of those things that is super valuable to know because it's the law. No worries, Noel. I'm eager to learn if there have been updates to that, but it is really helpful and something sort of like, how to properly interact with the police. It's like knowing how to understand the law, knowing what is the law and what isn't. It's just very valuable. And although I know most of us aren't working at orgs like Kentucky Fair Housing Coalition, where they have lawyers and are doing that direct advocacy for people, but it's surprising how many instances you come across of somebody just bringing something up about their living situation and being like, "Hey, I don't think that's allowed." And yeah, KYFHC is an incredible statewide resource for people. So yeah, they're going to talk to us more about that. And then I also know later on in April, I'll send that with the April monthly email. They're doing like a 3-hour long fair housing deep dive. So that'll be good too. And a final reminder to just submit service forms and timesheets. If you have any questions, don't hesitate to reach out to me. But thank you all so much for joining. And yeah, if you have any questions that you have for Kentucky Public Health Corps, I'm happy to forward them their way. But I hope learning about them was helpful. I definitely think so. I think there are ample opportunities for us to collaborate in our service to overlap. Yeah, thanks, Holly. That sounds good.